Hello, my name is Dr. Dewan S. Raja. Today I will discuss about fatty liver. Fatty liver, also known as hepatic steatosis, is a condition where excess fat build up in the liver. So, steatosis means collection of fat inside the cell or in an organ. It is caused by various factors, including excessive alcohol consumption, obesity, diabetes, and poor diet. Types of fatty liver, alcoholic fatty liver disease, AFLD, caused by excessive alcohol consumption, non-alcoholic fatty liver disease, NAFLD, occurs in individual who consumes little or no alcohol. This is usually associated with obesity and also sedentary life habit. What are the stages of fatty liver? Simple fatty liver, steatosis, excess fat in the liver with no significant inflammation. Non-alcoholic steatohepatitis, fat accumulation with inflammation and liver cell damage. Fibrosis, persistent inflammation, causes scar tissue formation. Cirrhosis, severe scarring and liver damage, leading to liver failure. Even in some cases, there may be chance of cancer. Causes and risk factor: obesity and sedentary lifestyle, high sugar and processed food intake, diabetes and insulin resistance, high cholesterol and triglycerides, excessive alcohol consumption. So these are the causes and risk factors. Okay, so if we look at the image from Robin's pathology, normal liver, this is steatosis, fatty chains, perivenular fibrosis. So fatty chains here, and this is the exposure and abstinence. So there is abstinence, it will go back to normal. Continued exposure to alcohol will lead to cirrhosis, fibrosis, regenerative nodule, even it may lead to liver cancer, hepatoma. Okay, severe exposure, hepatitis, liver cell necrosis, inflammation, Mallory bodies. These are inclusion bodies inside the hepatocyte that develop from the intermediate filaments. So inclusion body is present inside the hepatocyte. Fatty chains, repeated attack, okay, of hepatitis exposure will lead to cirrhosis, fibrosis, regenerative nodules. We'll find out the nodules on the liver. Okay, again, if there is abstinence, then it will turn back to the fatty chains. It may go to normal liver in many cases. Okay, we got that. Now, if we look at the histology, and also this is the macroscopic anatomy, we'll see multiple nodules. Okay, diffuse nodularity of the surface is induced by underlying fibrous scarring. The average nodule size 3 millimeter. Okay, these are around 3 millimeter. It is variable, not exactly 3 millimeter. In the close-up view, okay, types of micronodular cirrhosis of alcoholic liver disease. The greenish tint is caused by cholestasis. Microscopically, the this cirrhosis is marked by small nodules entrapped in the blue stained fibrous tissue. We have blue stained fibrous tissue and we have nodules. Okay. So if you go to the histopathology of alcoholic fatty liver, steatosis, and fibrosis, A mix of small and large droplets. These are the fat droplets. In clear vacuoles like these. These are fat droplets. In most prominent around the central vein. This is the central vein. Extend towards the portal tract. Okay. Portal tract is the periphery here. Some fibrosis, stained blue, is present in a characteristic peri-sinusoidal chicken wire pattern like this. This. So, so this is the histopathology of alcoholic steatosis and fibrosis. If you continue on histopathology, alcoholic hepatitis with cluster inflammatory cell. These are the inflammatory cell marking the site of necrotic hepatocyte. Mallory hyalin is present in another hepatocyte. We will get the hyalin here. In the figure B, alcoholic hepatitis with many ballooned hepatocytes. These are the hepatocytes, balloon hepatocytes. Cluster of inflammatory cell also present. We get inflammatory cell here. Inflammatory cell like that of neutrophil lymphocyte. Okay. With most hepatocyte, including this cell, with fat vacuoles showing normal cytoplasmic staining, but the balloon cell, the ubiquin and keratins are collapsed into Mallory bodies. We'll get Mallory body here. In the cytoplasm of those cells, we'll get the Mallory body. We'll get Mallory body. These are coming from the intermediate filaments. These are present, Mallory body are present in the cytoplasm of hepatocytes. So we have the alcoholic liver disease and non-alcoholic fatty liver disease. Alcoholic liver disease will get a history of alcohol consumption. Is chronic disorder that can give rise to steatosis, alcoholic hepatitis, progressive fibrosis, marked derangement of vascular perfusion, leading eventually to cirrhosis of liver. Because cirrhosis means more fibrosis and more damage to the hepatocytes. Consumption of 80 grams per day of alcohol is considered to be the threshold for development of alcoholic liver disease, but may be lower in women. It may be 10 to 15 years of drinking for development of cirrhosis, which occurs only in a small proportion of chronic alcoholics. The pathologic effect of alcohol on hepatocyte include changes in lipid metabolism related to altered redox potential, injury caused by ROS generated by metabolism of alcohol, and the P450 system and protein adducts formed by acetaldehyde, a major metabolite of alcohol. How about the non-alcoholic fatty liver disease? The most common metabolic liver disease is non-alcoholic fatty liver disease associated with metabolic syndrome, obesity, type 2 diabetes mellitus, and hyperlipidemia. Non-alcoholic fatty liver disease may show histologic changes associated with alcohol liver disease like steatosis, steatohepatitis, steatofibrosis, almost like that of alcoholic liver disease. The diagnosis of NASH, that is non- non-alcoholic steatosis hepatitis, okay, requires biopsy, and NASH cannot be reliably distinguished from alcohol hepatitis without clinical history. Okay, we need the history to differentiate between these two. Pediatric non-alcoholic NAFLD, okay, non-alcoholic fatty liver disease, is being increasingly recognized as the obesity epidemic involved pediatric age group. Its histologic features differ somewhat from those seen in adult. Okay, so We got that. Now we'll go to the next slide. Non-alcoholic fatty liver disease, non-alcoholic steatohepatitis. So it may turn on both in this direction 80% isolated fatty liver, none to very minimum progression to cirrhosis, no increased risk of death compared to the general population, advanced fibrosis is possible, non-alcoholic steatohepatitis, then we may have decompensation 3% to 4%, but we may have hepatocellular carcinoma. That is also possible from non-alcoholic fatty liver disease. There is a possibility. So this is the histopathology. Again, we're getting a lot of fat in the hepatocyte. We'll see the fibrosis around the central vein, and we may see some type of, that means non-alcoholic fatty liver disease, liver with mixed small and large fat droplets, while ballooned hepatocyte ballooned out because of a lot of fat inside it, steatosis and fibrosis extending along sinusoids in chicken wire pattern, this pattern in which individual and cluster hepatocyte are surrounded by scar blue fiber. Note the resemblance to alcoholic hepatitis. So this is almost like that of alcoholic hepatitis. We'll not get the Mallory bodies here, but other features are almost same as that of alcoholic hepatitis. Symptoms often silent early stages, fatigue, abdominal discomfort upper right side, unexplained weight loss, swelling in the abdomen, advanced stage, diagnosis, we do blood test, liver function test like ALT, AST, ultrasound or CT or MRI scan, liver biopsy in severe cases to confirm. Treatment and prevention, lifestyle changes, weight loss, losing 5 to 10% of body weight can significantly reduce liver fat, healthy diet, Mediterranean diet rich in vegetables, healthy fats, lean protein, regular exercise, 30 to 60 minutes of moderate exercise most days, limit alcohol consumption to avoid completely in severe cases, control blood sugar and cholesterol through diet and medication if needed. So what is the medication supplement? Vitamin E for NASH, non-alcoholic steatosis hepatitis, in non-diabetic individuals, certain diabetes, medication metformin, GLP-1 receptor agonist, omega-3 fatty acids for triglyceride control. So these are the medication. Most important is weight loss, healthy diet, regular exercise, and no alcohol if possible, maybe minimum alcohol, maintenance of blood sugar and cholesterol. These are the lifestyle changes that is most important. This may be added vitamin A, certain anti-diabetic drug like metformin, and omega fatty 3 fatty acid present in fish oil. And that's all about fatty liver. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now. And again, acknowledgement, I took information from multiple sources, including Robin Scotland pathologic basis of disease. Okay.